Okay, I'm going to show you guys medical hand washing. And first of all, you want to take your paper, get it ready right there for you. Turn the water on and get ready here. Get yourself a little bit of soap. And what you want to do is go around each finger about 4 or 5 times. 1, 2, 3, like this. And it shouldn't last for a really long time, 10 to 15 seconds. And the way that maybe you can give yourself a good rule of thumb is sing the ABCs in your head or sing happy birthday to yourself. And end with your wrist and then rinse it off from your wrist down. So about 10 to 15 seconds. And then get your paper towel. And then so not to contaminate your hands, once they're finished drying, turn the water off with a paper towel. Open the door with your paper towel, hold it open with your foot, put the paper towel in the trash can. And that way your hands are still clean. This is a medical hand wash, 10 to 15 seconds. Sing happy birthday to yourself or the ABCs, and that's about how long it should take. So get your towel first, turn your water on, get your soap, go around each finger, end with your wrist, and wash it from your wrist down. Okay, I'm going to demonstrate today how to change out a dressing for a CVC line, central venous catheter line. And first of all, you need to get them positioned and everything right before you change the dressing. We're going to put them in a semi-Fowler's position so they're not laying flat down on their back and they're not sitting up so the dressing doesn't fall off. If they have a cough or infection, or just pretty good protocol is to have them turn their head away from the site so you can work clearly over here without, any chance of them coughing or drooling or spitting on it or anything like that. And also, sometimes it's necessary to put a mask on your patient too to keep this area nice and clean. And then for yourself, you need to have a mask also. And your mask is found in your central line tray, so when you take it out of your bag, it should be on the top. And you're going to open this away from you to protect the sterile area there so it doesn't fall back and you contaminate it. And your mask is right there on top, so you can take that, and there's a bendable part here on top, and that goes over the bridge of your nose, so you can bend it over your nose like that and just wrap it around your ears. But I'm going to take this off and set it to the side so I can talk to you guys without hyperventilating there. So the mask does go on you, and you just pick it out of your sterile kit. You're going to start with clean gloves to begin with, okay? So I just got them out of the little glove packaging over here. And we're going to go to your CVC line now and come up here, and you're going to peel it from outer to inner to the inner port here. So kind of stabilize it and pull your dressing towards you, stabilizing it so nothing comes out, and then pull it from the center. And if you can see these two little holes here, most of the time your CVC line is stitched into the patient, and that's what holds it in place. But sometimes it isn't, and when you pull off the sticky stuff, it actually will pull it out a little bit, and you don't want that to happen. So stabilize it with your other hand and pull it from outer to inner. Now that I have this dirty dressing here, I'm just going to put it in my gloves, pull my glove over it, and the other glove over that, and you can throw that in the trash can. It's self-contained. At this point, I'm going to be careful not to contaminate anything, get my sterile gloves out, and I'll put them on the tray here. Sometimes it's pretty easy if you put your sterile gloves up on the side of your table. You can kind of bend your paper over the edge of your table. And putting sterile gloves on sterilely, you can touch the underside of this first glove, just not the top side. And now this one goes under the cuff this way, and you're only touching the top side of the glove. So you put your glove on like this, only touching the top side. So now your hands are sterile. This other way. And now I'm going to see what I have in here. this is a training kit, so it has a little bit extra. You don't necessarily need 2 Tegaderms. So I'm just going to put those together. This is an extra thing that would be put over this site if it was oozing or draining or bleeding, but most of the time you just want your Tegaderm to be there so you're not, so you're able to see the port. So we're going to put this off to the side. This has a couple extra and we only need 1, so this is your alcohol preps. I'm just going to get everything out so I can see what we have here. This is my trash bag. So I'm going to take it, open it up, get it ready. Set it right there, only touching the inside, because if you touch the outside you're going to contaminate your hands. So now I'm ready to start cleaning, and see these little notches right here? You can take and tear it right here, and then tear it on this side. And then another thing you may want to do, you can just pour it out in this little container here. There's extra alcohol in there, and if you don't know that, you're going to get it all over every place. So at this point you can take one of your little alcohol swabs, kind of stabilize this with your other hand, and you're going to clean from inner to outer. So start with a port, clean, twirl your big Q-tip so you're cleaning on the clean side of it, and pull the germs away from the port, inner to outer. So now we're away from the main site. We're going to bring it around our sterile field to the trash can. We're going to use all 3. Pull it inner to outer and swirl your Q-tip around. Okay. And then around your sterile site so you're not going over your sterile site with a contaminated Q-tip. And once again. You should be getting pretty good at this by now. And then bring it around your sterile site like this. Let it dry. If you need to, you can pat it dry with one of these sterile gauzes. Bring it around. Under here, since this is stitched down like this, you can't get under here with a Q-tip. So what you can do, you can get an alcohol prep, and if you tear your alcohol preps and make a habit of tearing them in the middle, so you can grab it like this instead of tearing it at the end and having to dig for your alcohol prep like that. If you tear it in the middle, you can just pull it out like that. And then go underneath and get it underneath there really good. And then you can take, even got a little bit of dirt out on this one here. So now it's cleaned all the way around. And you're going to take your Tegaderm. Going to place it right over the site here, and then I'm going to peel this outer portion off right here. It's kind of hard to peel off with gloves on sometimes. Then there's a little thing right here that you can put on it, and it says your date, the initials, so they'll know what time it was changed. You can put that right there and write on that. Now, a couple things when you are putting medication in these areas here, you want to make sure the clamps are open when you try to put the medication in instead of closed. And you can also change this from a needle system where you put the needle in the rubber port at the end to just unscrewing this and unscrewing the needle, which I don't have right now, and screwing it into there, because you really want to use needles the least amount of time as possible because you don't want to increase the risk of sticking yourself or your patient. But this is just your basic CVC dressing change where you just need to maintain a sterile area around here. So in review, patient is in semi-Fowler's position, their head is turned away, you wear clean gloves to begin with, you wear a mask, and you take it from outer to inner, put it in your clean clothes, throw them away, and then you get your sterile Q-tip and you swab it from inner to outer, pat it dry or let it dry, and put your clean tegaderm on it and put your date and initials on it.